You guys, welcome to the show. Everybody listening, this is Catt Sadler Now. I am Catt, and I'm here with my two new friends, Maggie Lawson. You've probably seen her on a screen somewhere near you, and Dr. Vinita Tandon from Lifeforce. So glad to have you guys here.
Thank you for having us.
Yeah. We're doing it different today, people. Normally, I'm in my little studio at Little Gem Ranch, sometimes doing virtual conversations, sometimes the occasional guest. But I have to say, I am so pumped to be here in West Hollywood at P-Volve Studios with my new friends, Maggie and Vinita. Welcome to Catt Sadler Now.
Thank you for having us.
Yeah. And then now, at this very moment, being a much needed, a very important, a crucial conversation about menopause. Let's call it what it is. It's not a dirty word, people,
It's hot.
anymore.
It's hot. Yeah. It's a hot
We're
word.
going to get into so much today, all of the things about women's health, our bodies, what everybody listening needs to know, regardless of their age. And I'm so excited to get to do it with both of you. But I want to ask you first, because I do this with all my guests, but just how are you? Like, actually in this moment, Maggie, we'll start with you. How are you doing today?
Wow. Actually, in this moment, I'm really excited. Maybe a little nervous, but I'm really excited, and I'm so happy to meet both of you. And I don't know, have this conversation. I've just been so fun catching up with all of the women. You all can't see them, but there are a lot of people in this room right now, and everybody's just been so lovely. So I think right at this moment, I'm very content. Yeah.
I love that.
How are you?
I'm good too. I think it's a good vibe.
It's a
I
real
feel
good vibe.
Good energy. Energy's everything to me. So I'm like you. I mean, honestly, I was sick 2 days ago. You guys have heard about this before we were rolling. I'm in good hands with Lifeforce. Thank God they've got an IV on the way. So I'm doing better by the minute, thankfully.
Yeah.
How are you?
I am good too. And I'm so pumped because this is my favorite topic to talk about. So I love the opportunity and appreciative for it and excited to be here with you guys for sure.
Well, I'm glad to hear you say that but we could definitely frame this in the way that, this is not your mother's menopause. Menopause, this conversation, this topic has come a long way, but it needed to. And we want to destigmatize this, and we want to really arm people with everything they need to know about this. But my first question for you is maybe just as the medical director at Lifeforce, why this topic in particular is so important to you personally and professionally, and why you want to really dig into it.
Yeah, I mean, I think for so long I've seen women struggle who they turn 40, early 40s, things start to change in their bodies, and nobody's giving them answers. And they don't know who to turn to. There's so much misinformation. I think perimenopause and menopause is probably one of the most one of the healthcare topics that causes the most confusion in people, in women, in their providers. Nobody knows, even the medical community does not know how to navigate this. And
that's scary.
So, yeah, that is scary. And it's unfortunate. And it's not fair to half of the population where menopause is as inevitable as taxes and death. We should all know how to treat it as medical providers.
This is a guarantee. It's not a maybe. It's like if you are a woman, unless you've had specific medical conditions perhaps or something that's very specific to your health journey, all women can count on this in their lifetime. Maggie, I'm just going to call you the baby of the group maybe because
that's so nice.
I don't think you're in menopause. Do you?
No.
When you were, invited to the conversation, why did you want to take part?
I'm curious myself, honestly. I mean, look, I turned 44 this year, and I think that some of what I've read and some of what I've heard and the conversations I'm having with my friends, I feel like there's a lot of is this weird sleep thing I'm starting to experience related to that or something? There's just lots of questions around all of it. Honestly, I may not be feeling anything of the obvious. I might not be in it totally yet, but that at the same time, I'm, I don't know, maybe there are other things happening beneath the surface I don't know about and I have questions about, and then I would learn about to ease the process,
You are a smart chick, right? Here's the thing. I mean, because until you age, this is probably the story. Most everybody's life is you don't wake up to what's generally happening in your body until you have symptoms of something going wrong.
Yes,
right? And
totally.
That's so many people. And I love that we're having this conversation and that you're a part of it because, and also so many of my listeners are are younger, 20s, 30s, 40s, whatever it is, and aren't thinking about this yet. And I love what you're doing because you have this thing called like the 5 at 40 or something.
Yes.
You tell us a little bit about that because it is so important to start thinking about like what is going on under the hood before you can't sleep, before you feel like you're going crazy in your own body, before, you know, your people closest to you are like, is there something wrong with you? Hey, Catt, could you get the cat I used to know? Could you bring her back into the business? Because I don't know who you are. Like all these things start taking you over and you feel very far away from yourself. But there's a way to start early and start preventing some of these things.
Yeah, I mean, I think just to take it back a little bit, the average age in the U.S. that women experience menopause is 51. But perimenopause starts 8 to 10 years before that. So for a lot of women, that is late 30s to early 40s. So, at age 40, we really recommend requesting your provider, going to a place where you can get at least the 5 core hormones checked. And these are DHEA, which is a prohormone. It's like the mother of hormones. You need it to make testosterone, you need it to make estrogen. LH and FSH, which are pituitary hormones, and they help tell your ovaries what to do. And then estradiol and progesterone, which are usually produced by your ovaries, but you can start to see changes in your early 40s or by 40. So you kind of can get an idea if things are starting to move towards menopause. And then lastly, which we underestimate, we think of it as a male hormone, but it's actually so important for women, is testosterone. And for us, it's like our mojo hormone. It helps us with libido, motivation, lean muscle mass. And that is one hormone that does start to drop in late 30s, early 40s.
And so have you been to your doctor and has your doctor, I'm curious, said like, hey, Maggie, maybe we should check these things. You're in your 40s at all?
No.
Yeah.
I mean, really, no. I mean, I think, if I were to say go have like a fertility appointment or something like that, maybe then when it's very specific to that thing, but not just in general, like it's not a part of my physical that I do every year with my regular doctor. Yeah.
Right.
No.
They just start asking you if you've had or if you're still having a period, which is really fun to answer. You're like, oh, that's so offensive.
Yeah, it's actually true. Or is it regular? Or is it? And it's always like, I don't.
Yeah, I mean, right.
Yes.
Right. So, I mean, listen, this advice, I think it's wonderful advice. I wish I had known at 40 to maybe, start advocating for myself and go to my doctor and say, I need this test. Is it something you can just get through your general practitioner? Do you just go to a blood lab? What way would you recommend women start with this information?
Yeah, I mean, ideally, you would go to your primary care physician or your gynecologist and request it. The sad thing is, to your point, you have to request it because it won't be offered to you otherwise.
Okay.
So
that's important.
And if you don't know to request it,
right. I tell all my women, you have to be squeaky wheels and put yourself first. I think women have put their kids, their career, their partners, so many other things ahead of their own health, their own selves. And now I think 40 is a good wake-up call. Hey, now it's time to start taking care of myself.
Well, again, that's why I'm glad we and others are now having this conversation. I feel like, and maybe you guys can speak to this too, I mean, even just 3 years ago, I feel like we are making progress. There are more and more podcasts popping up about this. There are more, specials. There's more research and things are changing. And maybe that began because of this big debunked study. So I feel like we should address that because I remember when I say 3 years ago for me, because I started talking about my perimenopause symptoms with my audience. And the more I talked about my hot flashes, the more I heard from other women. Oh, please, to keep talking about this. I thought I was going crazy. I can't sleep at night and, my sheets are soaking wet and I feel like something's wrong, but I don't know what. And so the conversation has been picking up, but a lot of the shift in that has been because of this 2002 study that was done on hormone replacement therapy that really kind of paralyzed the medical industry as it pertained to female health. Yep. Can you talk about that a little bit? What happened then and maybe how that is in some ways helping with reignite the conversation today now that that's been debunked?
Yes. So this was the Women's Health Initiative study. It was published in 2002. They looked at over 60,000 women, and they actually terminated the study early. And there was so much media hype about the fact that they said, the summary was that hormones cause cancer, specifically breast cancer. That was headlines everywhere. And it created a panic. It created a panic amongst women who were currently on hormones. It created a panic amongst their providers who are now yanking prescriptions away and saying, stop everything. And then all the women who were just undergoing perimenopause and menopause, they were denied hormone therapy. So this was over 20 years ago, and only now are we starting to see the tide turn. What happened after that, and by the way, many of us feel like this was one of the biggest travesties in medicine. What happened with that study and how the media took kind of false headlines in a way and just blew it out of proportion to the effect that so many women were denied hormone therapy. We feel like 30% of women, we could have prevented their heart attacks and heart disease if they had been on hormone therapy during these 2 decades. So, heart disease is still the number one cause of death in American women. And so right now, what happened in the intervening 20 plus years is that sub-analyses started happening. So they did deeper dives into the data. They did deeper dives into the demographics of the study participants.
Most of them were over 60 years old, right?
These are
women who are postmenopausal.
Right? Yep. Exactly. They were older. Many of them were smokers. They had other medical conditions. None of this was accounted for when they just said, oh, hormones cause cancer. Not only that, what I think is still so surprising for people to hear, and even the medical community they also don't know this, that the group that was on estrogen alone actually had fewer breast cancer cases and incidents of breast cancer. Wow. So study after study has validated that estrogen is actually protective from breast cancer. But we still link the two because of those stupid headlines 20 plus years ago. And so
that was before Twitter and Instagram where everybody was getting their news. The paper headline actually mattered, and that just sets everybody on fire, and that became the belief.
And there was no argument. There was nowhere to go to read a separate side to that anywhere, right?
Yeah.
Right.
Because that's those headlines that sell.
Right.
Yeah.
Unfortunately.
Right. And I'm just curious, hormone replacement therapy, since we're essentially saying that you're not there yet, was your idea of it, or how have you framed that? Were you thinking, oh yeah, that causes cancer? What had you heard? Had anything stuck with you, or?
I feel like if someone brought up hormone replacement therapy, maybe less now, but years ago, or I heard about it, or let's just say my mother, or that it was kind of I don't know if controversial is the right word, but a little bit of I don't know if that's for everybody. I don't know. There was just some hesitation around it that I'm assuming is probably from some of these studies that didn't make it the obvious or healthy or whatever choice that it might be for somebody. It felt more like something that was a bit scary, that we didn't know about, and maybe was harmful in some way. And that's why you had to be really careful around it.
Yeah.
That would be my association with hearing about hormone replacement therapy. Yeah. And maybe that is triggered from some of this misinformation that got.
Yeah, because not only did it affect our mother's generation, where they were, but then it trickled down to us too. Right?
Yeah,
fear and
on top of that, really measurable and unfortunate, the findings you're just mentioning that it could have prevented some heart attacks. It could have actually helped improve women's lives.
Yeah. Oh my God.
On the scale, that in and of itself is wild. But the lack of conversation, it almost sounds like that just shut it all down, right? So there was 2 decades where we weren't having conversations about what was possible. You were just told to live with how you felt, and your doctors kind of dismissed you because they didn't know, because they were told a certain way, and they're protecting their own self. It's just so full circle. So the fact we're even now having these conversations, yeah, you're right. It's good for, a woman sitting here now on HRT who, by the way, just a year ago, I took 3 years before I decided to even go on HRT because of all the reasons we're talking about. And even my partner saying, I really think I got to get some help here. I don't, he was afraid. Well, I don't want you to get cancer. The people around us are afraid because they don't know. It's the trickle effect is very, very real. Because I do want to talk about the many benefits, potential risks still, of course, for each person to consider. But I want to back up because menopause in general, by definition, I feel like even some people listening, especially if they're younger, what is menopause? How do we define it, right?
I literally was just about to say that. I was like, I think almost the words, even just like HRT, but like you hear things like, oh, it could be perimenopause or it could be menopause or it could be that, and we throw it around, but like, what does it actually mean? And what does each step of it, how might it affect my body or my life in some way? That we don't talk about. We know the words. Yeah. But yes.
We know that everybody thinks it's a bad word, but it's not.
Yeah.
It's not. We're bringing it back. Sexy back, menopause. But yes, if you could just define the stages for women listening, that would be great.
Yeah.
The stages and the definition.
So as long as you're younger, typically ovulating normally, every month you're getting a cycle, you are considered to be premenopausal. Then you enter the stage of perimenopause, which is the 8 to 10 years preceding menopause. So typically late 30s to early 40s. You might notice, you might skip a period every so often. You might not have the best sleep, especially during your PMS week. PMS seems to be a little bit more severe, your symptoms, more cravings, more moodiness maybe. And then menopause is defined as when you have not had a period for 12 consecutive months. If you have not had a period for 10 months and then you have one, the clock restarts. So it has to be 12 consecutive months where you have not had a period. Or you do blood work and your labs indicate.
I was waiting for that or because I'm in that bucket. But go ahead. I was like, wait. Okay, go ahead.
The FSH, which is one of our 5 biomarkers to check at 40, the FSH is in the menopausal range, and that can also define menopause. So that is basically your ovaries are pretty much not making the 2 most important sex steroids that you've been making your whole life up until then. Your estrogen and progesterone just plummet. Yeah. And that's why it's called menopause, because it really is so abrupt. It's not like men, when their testosterone goes down, it's like a 1% to 2% decline every year. For women, it is so abrupt. And for many of them, it's sudden, unexpected, nobody warned them. And it can feel like a truck slammed into them. Like, who am I? What body is this? Where are my emotions? I don't have control over things. Those are kind of the 3 stages.
And symptoms, we talk about some of the big ones. Hot flashes are always correlated to menopause, maybe, weight gain. I mean, that's when I was like, I'm getting on the HRT, if I'm being really honest. I was like, this is crazy because nothing I was doing. I'm like, work out pretty darn consistently. I eat pretty clean. And I was like, everything is changing. None of my clothes are fitting. I was like, that's the final straw. I'm sorry, I'm being very vain by saying that. But that was on top of 10 other symptoms on the regular. I was like, I just knew that wasn't the way I was built. That for me was like an obvious one. But we hear that a lot from women. What are some of the other ones I think that are a little more vague or maybe less common? Things like ears. Weren't we just talking about ears?
Ears?
We were talking about ears before we started. That was shout out to Paige for Life Support. We were talking about somebody having itchy ears. Anyway, but itchy ears isn't that a symptom?
Yeah, itchy skin in general.
Oh my God.
Or ringing in the ear maybe, or maybe I'm making this up because I'm menopausal. Or I had the flu. I'm not sure which. I get a pass. But there are some, the list is long of potential symptoms, which also makes it why it's often misdiagnosed. Yes. Would you agree?
Yeah, 100%. And I also think that women just are in a bad habit of dismissing their symptoms. They don't always flag it, even with their providers. And, we know doctor visits are in and out often. And so women don't even think to like, oh, hey, by the way, I'm not sleeping as well. Or I feel a little foggier. I don't feel as focused. Or my memory is not the same. All of those things, everybody kind of poo-poos or dismisses it. It's just old age. It's just getting older. Just deal with it.
Right.
And so there's just this really dismissive sentiment, I think, as women kind of get into this part of life. But if you think about it, if the average age of menopause is 51, and many of us hopefully will live to our 80s, that is many years to not have these important hormones that affect so many, the way we feel, the way we function, our metabolism, our muscle mass, our body composition, our immunity, our bone health, our heart health, our cognition.
So the way to kind of know for sure with all the symptoms that it could be is actually checking your hormone levels as regularly or as you can, is what we're sort of like also talking about. Is that the sort of surefire way to know exactly where you are?
Yeah, exactly. If it's been a while, it is a good time to just check under the hood.
Yeah.
Get a bunch of things checked, make sure everything else looks good. And yes, okay, this probably is all related to menopause.
Right.
Getting the lab work is so important. And I know people know they can go to maybe a laboratory somewhere, but at Lifeforce, you guys have this beautiful setup where it's easy and people can even come to your home and you take all of the heavy lifting out of it. How does it work if you become a Lifeforce member?
Yes, so we definitely want it to be convenient and accessible. Nobody should have any excuse not to look under the hood and get things checked. So somebody would come on our website, they purchase what's called a diagnostic, and we will actually send a phlebotomist to their house typically and draw their blood, which we check over 50 different biomarkers. And the blood work is processed at a commercial lab that has gold standard assays. We also ask everybody to fill out a pretty good comprehensive health questionnaire. So we want to know their medical history, their surgical history, family history, and then more importantly, how are they feeling in kind of their top 10 quality of life parameters: energy, cognition, sexual health, social connectedness, stress, all of those things. We get the results of the lab work. We get the results of the answers to the questionnaire. We have an amazing dashboard that members have their own portal where they can see all of their numbers and they get the answers to their questionnaire, which are all populated there. We have a metric called the Life Score, which is kind of our North Star. So that tells us, it's out of 100 points, where are you kind of running? 60s, 70s, 80s. Our goal is 80s and higher. But it gives you an idea of kind of, at this moment, a snapshot of your health. And then the clinician gets all of this data and kind of prepares for the visit. And the visits are all remote via telehealth. So again, super convenient. You just need a laptop or a computer and Wi-Fi. And the clinician will spend at least 30 minutes. So it's a nice long visit to really do a deep dive into the biomarkers, into the health history, into the members' goals, whatever they may be for that quarter. And then the clinician will create a personalized individual plan depending on all of those factors. And then we will even send, if there are any supplements that are prescribed or pharmaceuticals, again, that's shipped directly to people's homes.
Wow.
So,
makes it very easy. I'm excited.
yeah. And then we do the same thing every 3 months so that we can keep moving the dial on optimization. Right?
Do I still get to see you, Dr. Vinita?
Yes.
Can you get your same clinician every time?
Yes, definitely.
Okay, I'm requesting you.
So sweet. Yes. We do want there to be continuity of care so that, it's good for both the clinician and the members love it too. So.
This feels like the future of health. Is that what, I mean, it's like, why aren't we doing it this way? And the fact you can actually have a 30-minute conversation with someone who knows every detail of what's going on. And like, I can't tell you the last time I actually was in person seeing a doctor and didn't feel like rushed.
Yeah.
I'm like, oh, sorry. No, one more question. Oh, sorry.
Yeah.
You know, that feeling where you're just like being just run through the mill.
Yeah. And also the apps now, you get results for things like, I'm like, I don't know how to read half of what's coming through and which I love. I love that we get the results at the same time the doctors do now and all that's great. But half the time I don't know what any of it means. And then you may never hear from anyone. So you're like, all right, well, I guess I'm okay.
Yeah.
Like, okay. So like that incredible.
I think another thing we struggle with, or at least I know I do in, doctor visits and the many doctors we've got an OB, maybe we have our acupuncturist, maybe we have our general practitioner, then we got to get a mammogram, and then you get, you got to get a colonoscopy. You're managing so many parts of your health when you think you're really doing a service because you love your body and you want to live long, and this word longevity we talk about all of the time. But sometimes you do things and it's like, then you have the information. What do you do with the information? That could be really tricky for people to navigate too. Like, I'm thinking of Maggie. We're gonna tell her to leave here today and go get her blood work, and she's gonna go and do this. But then you have to also make sure that someone is helping you interpret that information. And then where do you go from there? Is there any advice on that subject?
Yeah, such a good point. I think menopause has somehow fallen into no man's land, where the PCPs or the primary care physician thinks the gynecologist will do it. The gynecologist is worried about PAP and pelvic and other things and doesn't address it. And so nobody's addressing it. And we know people try to go to Dr. Google. Dr. Google is giving conflicting advice. So I think that it is really important to find a provider who is versed in menopause therapy and diagnosis, and who is really up to date on the current recommendations and guidelines that are evidence-based. So it's A to Z. They're looking at you holistically. It's not these siloed places where all they do is give you hormone prescriptions without knowing your cardiac status, or without knowing how are your electrolytes, or how is your liver health. You need somebody who can look at all of that and then give you a personalized plan.
I feel like I'm interviewing Maggie about her personal health right now. I'm sorry, I'm going to ask you some personal questions, but I'm just thinking, are you taking supplements right now? Is there anything you're doing preventatively? Are you even thinking about this word longevity? I wasn't when I was 44. So I'm just curious if you are.
Yeah, I'm thinking about it.
Yeah.
I haven't necessarily started any sort of regimen or anything like that. That could change after I go and do my blood work after today and everything else and see kind of where I am. But no, I haven't been, but I'm curious. And I would like to know, as far as everything, for me at this point, from taking care of where I am currently and also preparing for whatever is to come, So, but no, I'm not. This is why, this whole conversation is absolutely fascinating to me, because I feel like lately among my friends, this has been a real topic, the perimenopause. Is it perimenopause? I don't know if it's perimenopause. I don't know if, where am I? There are just so many questions around it. And so, no, I haven't started any sort of process, but I'm open and I'm curious, and I feel like that's why I love that we're having this conversation. And also, when I told, I was at a dinner the other night with a lot of my lady friends, and when I told them I was doing this talk, they were like, "I love that you're doing that. I love that there's a conversation happening about this in this way, And I know you are saying not your mother's menopause, I think is the kind of the line for this, but I just like that there's a conversation about it. So for me, I'm open and I'm curious, and I want to be prepared for whatever process or whatever's coming. But no, I haven't started anything yet, because like you said, part of me is I should be thinking about this, but it's also not necessarily at the ready, to find the conversation about it either. So I like that we're doing this to open that up.
And thank you for being a willing participant.
Yes. Yeah, you know what? I'm here. I'm I don't absolutely. And I also in my head I was like, are these? I have some questions. They might be dumb questions, but I feel around from birth control, which are hormones.
Yeah.
Also, sometimes you hear a lot of, and again, everybody to their own body and what's right for you and all of that. But those are hormones, and I know this might be so stupid to say, but what is the difference in so you're taking hormones for sort of keeping your ovaries quiet and keeping, that whole process quiet. And what then is the difference, say, or is there any harm, or is that just stuff we might hear about it? You've been on it too long, it could affect you long term, or does that somehow interfere with HRT in some way? I have friends who are still on the pill, older than me, that are, I don't know if that's even the part of this conversation,
but not stupid at all.
As we were sitting here talking, I was I wonder how birth control factors into this, and for people my age, and you were talking about late 30s, kind of that being a backup from menopause, when that perimenopause might start, and could birth control or anything hormone related affect that? Or is that kind of, I don't want to say a myth, but I don't know, maybe not part of the discussion, doesn't need to be part of the discussion because they're two totally separate things.
Yeah, no, it's a great question, and I'm glad you asked. So far, the data looks like birth control doesn't really influence the hormone therapy after menopause. The birth control, like you said, is developed to suppress ovulation so that you don't get pregnant, whereas hormone replacement therapy is now just to replace the estrogen and progesterone no longer.
Yeah, got it.
Yeah.
Good. Okay.
And what about the different types? I think it's important to talk about. I think one of the other reasons that study was very scary for people, my understanding was that the hormones in that initial study in 2002, they were synthetic hormones. And hormones themselves that are available to us today have come a long way. They're bioidentical, therefore not as harmful. Is that right?
Yeah, no, exactly. But I will say some practices are still using the old synthetics, so you have to really ask and be careful. But that's right. In the Women's Health Initiative, because during that time, that was the hormone regimen available, which was synthetic and in high doses. The estrogen that they used came from horses' urine. So just think about that. So the one that we use now is estradiol, which is the same, molecularly identical to the hormone we've been making. And then micronized progesterone, same thing. It's molecularly identical to the one we make naturally.
Okay. And what's in the pill? I don't know. That's my dumb question. Is that synthetic or bioidentical?
That's synthetic.
In the birth control pill?
Yeah.
Interesting.
Fascinating.
Okay. So there is that difference, I guess, between
totally.
HRT and the pill.
Yes.
I didn't know that.
I didn't know that. Tilda? Hey, there you go. Now we know we're learning something. Okay, well, and just to get back to, let's take the case study of the perimenopausal, let's say 40, that decade. And the reason I asked you about, what you're taking, if anything, I hear this again and again, and again, I just want to spread the information because I wish I would have known, and I know my mom wishes she would have had, So I keep hearing what you do in your 30s and 40s has everything to do with how you age, right? Maybe it's even the 20s. I don't know. The way we live, we start to express the way we lived in our 50s, 60s, and 70s. And then disease, we are laying the groundwork for all of this crappy older age potential decrepitness. No, but you know what I'm saying? So we have a way to, through the way that we live in our earlier decades, to really influence the quality of our aging life is what I'm getting to. So if she's going to go and leave here and get a blood test, what other things can this perimenopausal group in their 40s be doing now so that by the time she hits menopause, she's not experiencing just the worst of the symptoms perhaps, or maybe she avoids HRT and doesn't even need it. I don't know. But are there things women can be doing who are listening now to really arm themselves to prevent the worst of it?
Please don't say cut out wine.
She's going to say that.
Okay, I won't
She's
anymore.
certainly going to say that. I'm kidding. I know. It's okay. I can handle it.
I'm with you. But yeah, along those lines, it is to eat healthy and clean. Cut out excess alcohol, drugs, smoking.
What does excess mean? Some of it's mandatory, okay?
Thank you.
It's all relative.
Fine, excess.
I think, too, having good sleep habits is super important. With devices, I think we're all very sleep deprived, and that doesn't get any better as you age. Your whole REM cycle is affected by hormones and the aging process in and of itself. So just setting yourself up for good sleep habits makes it easier when you hit menopause. Hydration with water, not wine. And then stress mitigation is huge too. I think that's the other thing we underappreciate is the impact of stress.
I am so glad you said that. I think that is a massive piece to this puzzle. The cortisol levels and everybody's nervous systems today. Again, I hope I'm not speaking for myself, but I talk about wellness on my podcast for a living, and I do my yoga, and I even have a garden now, and I meditate every day, and I just got some results back that was like, what is going on with your nervous system, Catt? Like, terrible. I scored a big fat F, and I was like, oh, I just couldn't believe it. It's like, even if you think you're doing all the things to mitigate the effect of stress on our brain health, and which is our body health, it's hard to score well these days because everything's coming at us, and all that is required from us as women in particular, and at midlife, that's got to be hard too. But no, like there's just so much required of us. Yeah. And even when, like, again, I guess I'm so used to performing. Look at all of us sitting here. You know what it's like to be on. I mean, there's a certain pressure and a depletion that doing a lifetime of that, being the yes girl, doing all the things females do in society, like it's no wonder like we're crumbling. Maybe, and we don't even know we're crumbling because we're so masterful at pulling it off all the time.
Yeah.
Right.
Yeah. It's true. I kind of love like everything you were just saying about how to prepare ourselves and how to, ease it. And what you're talking about with stress. I feel like so much of it is just bringing awareness back to ourselves and our body and our needs and taking care of ourselves and sleeping and eating well. And it's so hard for us to take time to do that. And yet it's pretty basic in like, wow, these things really do cut your stress down and keep you healthy and make all of these other things that are going to come later easier. And I love having the conversation just around that. I know we talk about self-care so much and all of that, but it's actually true. And then to have a conversation about this and it be also about really taking care of ourselves and taking the time to do that, figuring out sleep, eating well, cutting out wine maybe. But like, you know what I mean, to actually pay attention to our bodies and what they need, and then to have resources available to actually tell us what's going on so we can address that as well, where our hormones are and all of that. Like, I love that part of it. It's sort of an excuse to be like, I need to rest because of what's going on.
Learn how to say
I
no.
need to
And
sleep.
we shouldn't need an excuse.
Yes, you shouldn't need an excuse. That's the whole point.
Right.
But like, I like.
Yeah. How about we prioritize? How about we start teaching each other and society that we don't need an excuse? Like, that is priority number one.
Yeah.
Rest.
Yeah.
That sounds fair. But you know what? That's
obvious.
That's probably why I felt like, even with HRT, I think there was a sense of guilt on my part that felt like giving up in a weird way. I was finally convinced by a friend who, she was the one who was telling me about the study. This was like a year ago, and she had gotten on HRT, and she's like, I feel like a different human being. I feel like myself again. She was in a dark place and really struggling with anxiety and depression, which I know is another massive symptom, a very common symptom of menopause if it goes untreated. Yeah. And a lot of misdiagnosis where women are getting prescriptions for antidepressants instead of hormone replacement therapy. Do you see that a lot? Are you hearing about that?
Yeah, all the time. You're exactly right. That is what it's a default. Oh, you're anxious or you feel depressed. Here's an antidepressant or an anti-anxiety medication. Oh, you have vaginal dryness, sex hurts. Use lube. Or you have sleep issues, here's sleep medication. All of that could be solved if you just treat the root cause, which is replace the hormones that are now at zero, and let's bring them back up. All of that goes away. It's the only treatment that I can think of in all of medicine that cures so many ailments and symptoms all at once. And so much safer than being on long-term sleep medications or long-term antidepressants or anxiety medications. It doesn't even compare.
And you're not worried about the risk factors or the downsides. And I mean, how do you determine, like, does the person just have to be super, super healthy to be the candidate, or are most all women candidates? Like, break that down a little, because I still think people are like, yeah, but that's still something going in my body that is foreign, right? It is still something I'm taking. Like, now I put my patch on every 4 days and I take a pill at night. And there's a part of me that's like, oh, I thought I was going to be so holistic and not need something like this.
Yeah, I mean, I think that number one, it's good that they're natural, they're like bioidentical. So the same as what your body's been producing this whole time.
Okay.
So it shouldn't feel foreign in that way. And it is a little bit of a difference and a change in mindset. You know, when we were dying in our 50s and you go through menopause and then you're just living another maybe 6-7 years, okay, nobody cares. But now that we're living another 20, 30 years without hormones, it changes the game. And most of us are still doing a lot of things in our 40s and 50s and 60s. We're not.
I haven't started yet. I don't know about you guys, but I haven't even gotten started.
Oh, yeah, same. I haven't grown up yet. No,
Right?
no, absolutely not.
No,
yeah.
no. So I think
I'm serious.
No.
By the way, I am
Same.
serious.
I hear
like
you.
the best things to still accomplish.
Yes.
Do you feel that? I don't know. I feel like I'm experiencing something, and then maybe this is also supported by like what is also happening. But I actually feel like I feel younger now than I did even 10 years ago, and I definitely feel younger than what I thought 44 would look like when I was younger. And I don't know, like, so I do actually have real feelings around like, oh no, like we're just getting
spending
started.
less time. Like in our 20s, we're spending so much time in our heads because we don't know ourselves yet.
Yep.
That takes up so much space.
Yep.
And then you get
Yep.
older and you're like, oh, I kind of know who I am now. And I get wiser with every year. So then that's probably your aura, your essence is youthful and it's
Yeah.
shining, baby. 'Cause
Yeah.
that's who you are and you're not cluttering it with all that other
Right.
crap.
Right. Yeah.
Yeah.
We care less, I think, a little bit more in our 40s. I do feel like that's been my favorite thing about being in my 40s is having a little bit more of a like, this is who I am take versus anyway. But yeah, I'm not growing up yet. So.
I don't want to ever grow up.
No.
Let's never grow up. But permission to be ourselves, permission to choose or not choose. Now, if we can at least tell people what is available to them.
Yep.
What do you say to the old school people who say things like, genetics, women, this is what's supposed to happen to our bodies. We don't make children anymore. The female anatomy is supposed to, all the eggs dry up, and then you're supposed to be done, and you're supposed to get on with life. That is the natural evolution of a woman's body. So, HRT, throw that out the window. Because there are that school of thought. Like, This is what's supposed to happen to your body. Why are you fighting it?
Right. I mean, I think you could say that about anything, right? If your blood pressure is high, would you not treat it? If you have some other medical condition, would you just be like, oh, well, that's nature taking its course? I don't think so. I think most of us, and we're so lucky now, at least our generation, to have a therapy that not only is so effective and beneficial, but so low risk. So you get the best of both worlds. And to your earlier question, who's a candidate? Yes, almost every woman. There are very few contraindications to hormone therapy. And there is something called the therapeutic window. So study after study shows that the sooner you start it, like right at the onset of menopause, the more benefits you have and the reduced risk.
Great.
So the earlier you start, and then a study just came out, was published a few months ago that showed women who even took it well into their 60s are still having benefits. Less mortality, less heart disease. So
I just heard Halle Berry say the other day she's taking it until she dies.
Yeah.
Oh, no, she's like, I'm taking this to forever, ever.
Yeah, exactly. And so I think we're so lucky that the tide is turning right now for us, and that if we have daughters and the next generations, we'll definitely hopefully have a much better outlook than us trying to navigate this on our own.
Oh.
Yeah.
To share another little tidbit with you guys, because again, all my listeners know this because they've heard about my plastic surgeon, Dr. Kim, who I talk about all the time, is one of my great friends. But anyway, he was one of the doctors. My OB dismissed me when I asked about the HRT. She was just like, is it really debilitating? Like, it was like I had to come in like on a gurney if I was going to be treated. So that and then I just got a little embarrassed and I just swallowed what I was feeling and didn't return to her. And, so there were a couple of people who weren't really big proponents of the HRT, but it was, interestingly enough, was my plastic surgeon who was like, I'm such a fan of this. But you know why? Not anything to do with vanity, of course, but about heart health and bone health. He was like, do you know how many studies are out there? This is good for you. He was like, if I would tell my daughter to do this for sure. So I'd love for you to just talk a little bit more, because we're always like, everybody knows about the the old risks or the old things we were told about it, but not only does it now just alleviate symptoms, there really are positive benefits in addition to alleviating those symptoms. Can you talk about what those are and how we might benefit from that?
Yeah. So one of the big ones is heart disease. And there have been multiple studies. There was a huge one that took over 100,000 nurses. It was an observational study, so not as rigorous as a randomized trial, but they found that the nurses who took hormones had fewer cases of heart attacks, fewer strokes, fewer cardiac events, and had a mortality benefit. And so the sooner, and that's the theory behind this therapeutic window, is that the sooner you start hormone therapy, you don't give your body time to build plaque. So you're not having years without hormones where the atherosclerosis starts to kick in and you start to make plaque in your coronary arteries. But if you start hormones right away, right as they're dropping, you just come on in and start, you don't allow that to happen. And so you do reduce your risk of heart disease. So especially for people who already have maybe family history of high cholesterol, family history of heart disease, it's super important that they use hormone therapy.
Do they ever prescribe HRT for those people for those reasons that might not be suffering from menopausal symptoms, but just have
Not yet.
Okay.
Yeah, I think that everyone still they want you to be officially menopausal.
Okay.
Most have symptoms, and then we would have multiple benefits for using it. But if you were completely asymptomatic, one of the lucky ones, most of us would still not prescribe just to prevent heart disease. Okay. I think that will change as more and larger studies come and get published. But right now, that's kind of the standard of care.
And now I've got my dumb question, but not that yours was dumb, but you just were saying it was dumb. It wasn't dumb. But now I'm preceding this with I feel like it's a dumb question, is that the osteoporosis, like what do hormones have to do with our bones? I have no, I'm like barely past biology.
I'm very curious. It runs in my family big time.
Yeah. And I think that's another one we underestimate, but it's one of the top 10 killers is osteoporosis, which leads to fractures, which leads to morbidity and mortality. But hormones play a big role in bone turnover. So you have bone building cells and you have bone destroying cells, and that ratio naturally changes as you age. But without hormones, that accelerates it. So you get more bone destruction than building. And then when you start hormone therapy, you reverse that again. So you get to more youthful levels where the ratios go back to more youthful proportions, and so you get more bone building again.
I love learning this, and I'm also like, I'm thinking about my mom right now, and how much I wish this information had been out there for her. Yeah.
I feel sorry for that generation. I really do.
Yeah.
I actually interviewed my mom about when I started really taking an interest in like midlife health for women. And I was like, what was your menopause like? And it was just like, nobody even talked. I mean, like you wouldn't even talk to your girlfriends, let alone a podcast that's, heard around the world, like no discussion at all. And everybody was just taught to get through it, suffer through it. So yeah, I feel like we let them down somehow, but we're going to turn it around for the next ones. Just to get a little specific on HRT, because we could talk about it for 3 hours, but I think if I'm listening and I don't know what it is, but I want to know, we've said hormone replacement therapy, but then the actual application of it and how it looks, because you hear about there's the patch, and then there's a pill you take at night, and then maybe you add some testosterone cream, maybe you don't. But I also think it's interesting, and I'd love to get your thoughts on, it's not one size fits all either. And I had another wonderful doctor on my show last year, and who gave me such a sense of peace, because she's like, it can be very regimented. Take for 2 weeks and don't, or take this exact, and in 3 months you change, and it's still your body. And the way you react is going to be different than how you react. And it's not like one prescription fits all. And to listen if things feel off to your own body, and you can work with that initial recommendation from your doctor. Keep speaking up, because even after you're prescribed, there's the window of trying to learn how your body responds and then what you're feeling, and you can make adjustments, and we're allowed to do that. And isn't that cool? Like, because I don't think we do that enough. We just go, okay, that's what my doctor said. I'll do that. And then keep quiet and just stay the course. But how does it look once, let's say a patient comes in and you know she's a great candidate, she qualifies, it's going to be good for her. How do you determine what level you put her on and what you give her exactly?
Yeah, I mean, in general, when we talk about hormone replacement therapy, we're usually referring to the two hormones, which are estrogen and progesterone. And ideally, you want to use the bioidentical versions of both of them. So for estrogen, that's estradiol. And for progesterone, it's micronized progesterone. So those are the two that we use. The estradiol, you can take it orally. You can take it, use a patch that you change out every 84 hours, 3.5 days. You can use a cream. In our practice, we prefer the patch, and for a number of reasons, but mainly because it is associated with a little bit less of a clotting risk than the oral can be. However, for some women, oral works out better. So that's, again, to your point, why it's so important to individualize the regimen. And for some women, we do start out very conservatively on our dose because maybe they were on birth control before and were really sensitive to it. So yes, let's start out slow with hormone therapy too. Or they have endometriosis or fibroids, we'll start conservatively. Whereas other women, we know they just need higher doses of everything that they take. So we might start a little bit more robustly. And then progesterone, the best way to take it is a capsule at night. And it is the one hormone that restores your sleep and your REM cycle and the deep sleep so that you feel fresh and energized the next day. Because for so many women, that is this vicious cycle. They're not sleeping at night because they don't have progesterone. So they're like covers on, covers off, restless. The next day they're tired, they're foggy, they're searching for energy. So typically that's sugar. So then they eat like the wrong sugary snacks or more carbs than they probably would have otherwise. And then they don't feel good about themselves. So just you're in this vicious cycle that hormone therapy can completely break. And yeah. So, but yes, our philosophy, and this is one thing that I always emphasize too, is the importance not only of clinical response. Yes, at what dose do you feel best? But also looking at blood testing and levels to make sure that, again, that you are at therapeutic levels, ideally.
Okay. The other thing with menopause, other than maybe the hormones just themselves, is wanting to continue to build like a good, healthy body composition as we get older, back to osteoporosis and our bodies changing and whatnot. We hear a lot about weight training today as far as exercise goes, just for people listening who, you know, whether or not they're on HRT or not, or whatever they're doing in that department, working out, diet, like what are some other great takeaways they can hear today that will help them through their journey?
Yeah, strength training is definitely key. As we get older, it becomes more important. Weight-bearing exercises, which help us with bone mass, preventing osteoporosis. And it is because we start to lose lean muscle as we get older, and especially when our hormones kind of plummet like they do in menopause. So ideally, a few sessions of strength training a week, but also balance, flexibility also becomes more important as we get older. And then diet-wise, we kind of alluded to before, yes, the one thing that some women aren't used to is upping their protein in their diet. And protein is one macronutrient that we definitely emphasize as we get into kind of this mid-age period. And again, because it's a muscle builder, it's your building blocks for lean muscle mass.
So actual food being the foundation of any good diet, but about supplements, like I take on occasion amino acid powders because I know they have tons of protein, the essential aminos and whatnot. Is that something you recommend? Or what are some, I hear omegas are big. Can you touch on some of the supplements that would be important to take also?
Yeah, omegas for sure. And those help you with hormone production as well as heart health. So salmon dietary sources are good too. Salmon, flaxseed, olive oil. But then if you're not getting it through your diet, supplements can really help. Similarly with calcium. Ideally, you're going to get enough from your diet to help your bones, but if you're not, we would recommend a supplement along with vitamin D. DHEA is a supplement we often recommend because, again, it's a precursor to testosterone, so it can really help restore those values. And then if you, for any reason, can't use hormone therapy, there are some supplements that can help with hot flashes and night sweats. There's one in particular that's really effective called Rapontic rhubarb, and that really can help with those vasomotor symptoms if you can't take hormone therapy for whatever reason.
What about it like my stage or where I don't know that I'm entering into that or that I'm in that yet or whatever. I guess I'll learn with my blood work. But even just not knowing that, somebody who, I'm aware of my age and, is there anything I would and should start, adding into my diet or a supplement or anything like that at this point that would be good?
Yeah, I think in general, for most people, a lower carb Mediterranean diet is pretty generally healthy for most people, which means you're emphasizing lean proteins, the healthy fats, colorful veggies. The more color, the better, a variety of colors. But then I would say it's really the labs, which will tell you if you're deficient in any nutrient, and then we would restore it at whatever dosage is required.
Great.
Yeah.
I have a question about labs too. So how often should we be getting them, and or how soon does our diet affect our labs, right? Let's say you have a great summer, or Maggie was just in Vancouver shooting a movie, and no, she was just craft services all day.
Yeah.
She just her diet was a mess, right? If she comes back, her labs are going to probably look different than they will in December.
Right.
So how often do we, because I know that I'm not very
really
disciplined, right? Sometimes I'm eating really, really well.
Yeah.
And then before you know it, you've got to make an adjustment because how long does your body remember these things?
Yeah, it depends on the lab, but for, let's say we were looking at cholesterol, for example, at least 3 months. So if you had a crappy summer, but then you were like, okay, I'm going to be on track now, we would give you at least 3, if not up to 6 months of healthy lifestyle strategies before we check again. But it's a great way. The more you check, the more you can correlate it with your lifestyle habits. So if you see that, oh, you know what, I had 2 weeks vacation and I drank more than, and your liver enzymes are a little bumped up, that's just evidence that, okay, maybe I should cut back a little bit on the wine or whatever it is.
Yeah.
Yeah.
I like the regular check-in, I feel like it's usually my physical is once a year. And so it's whatever's happening at that time and that's that. But knowing 3 months later, I could actually know for sure if this change I made is working or not, or maybe something else is going on. I think that's great.
Yeah.
So,
and especially in middle, this is the time where things start to come up. All your family history stuff, genetics. This is a time where your blood pressure starts to change, your cholesterol starts to go up, maybe your blood sugars. So yeah, the more often you check and look under the hood, the more proactive you can be in mitigating those chronic conditions.
And your testosterone dropping.
My favorite
We didn't even talk about libido today. How did I bury libido? That should have been the lead. You know why? Because I'm in denial. Okay? No, truly. I was like, that is never going to be a problem for me. I was so convinced. That's when I knew I was in menopause. I was like, I just feel dead inside and I could care less about sex. That is crazy. So that is a real thing. I now can attest that happens at age, menopause, losing all your other hormones is just, and then proven on my recent blood tests with Lifeforce. So testosterone cream is often a companion prescription for women in menopause. And why do you like the use of that? And how?
I love it.
Yeah.
So
Obvious.
she's like, I don't like it. I love it. And here's why.
You're going to love it. And so is Greg when you get home. Okay.
exactly.
Greg's going to be like, yeah, we should have done this a long time ago. Okay.
Yes, it is often the companion. For sure, in our protocols, it's as important as the estrogen and progesterone are. So if a woman does demonstrate that her levels are in the toilet, we will definitely recommend it. It is still considered off-label use. So the FDA has not approved it for use in women, but we have so much data about the
Because
safety.
it's for women.
Uh-huh.
But wait, it's approved for men?
Uh-huh.
Oh, did we?
I'm
Did
sorry.
we say that again? Hold on. Wait a minute. So the FDA has not approved testosterone for women for this purpose
That's right.
because they want us to suffer.
Or just deal with it.
Yeah.
Yes.
Wow.
Okay.
Yes.
All right. So it is technically off label, but what are you hearing from patients?
Oh my gosh, you gave me my life back. You gave me my marriage back. You gave me my mojo back. I have never felt so good in so long. Yeah, it will bring tears to my eyes because it's just so powerful, that hormone. I think it's better than any couples counseling or therapy, especially because it restores your intimacy. It puts it back on your radar. You will initiate again. Yeah. That's one complaint a lot of partners have is like, she never initiates anymore. So then I feel like I'm begging for it, or she's just not into it. So then I'm like, I'm not into it then. And so you kind of drift apart, right? It's just a vicious cycle. So it's so powerful in restoring that intimacy, that connection, not even with romantic relationships, but even like platonic relationships. It just restores kind of your interest in others. You feel more engaged, more present, more focused, motivated in careers. It helps. Testosterone is one hormone that helps you with ambition, with feeling driven.
Wow. I'm like, this, wow.
Yes.
That's incredible. And it's also so lovely to hear that the majority of people who are experiencing that are coming back with such profound results and like happiness and, finding this, because it's healthy to feel that way. Even like you said, if it's not just in the bedroom, but like in the world, to feel like a sexy sexual being in the world is good for us.
Yeah.
I know we probably won't be able to use that because of the thing, but whatever.
Oh no, we're using it, people. But ambulance, that's fine.
Wait, I was supposed to say, it's like, it's a fire, we said, but I, that's such a great thing to hear. And even talking about like the ambition and how we operate and act in the world. Like, I feel like that alone, when we talk about stress and we talk about feeling our best and the way we combat things within our bodies, like longevity wise, like that's the kind of stuff that gives you longer life, I think.
Yeah. And it improves your body composition.
Exactly. That's what and your well-being.
Yes. Yeah.
Feeling alive.
Yes.
Women deserve to feel alive if we are living and breathing.
Yeah.
But you don't always, because you are depleted or deficient or all of these things. This is a hopeful conversation. I mean, I think that's a beautiful place to leave it, because until recently, it's just been, it's been stigmatized. You don't want to have the conversation. There's been all of this negativity attached to HRT and just this period as a whole. And I really meant it. And what you were saying, like, we feel energized. We want all of that to be one cohesive self, like, right? Like what we know to be true, we feel like we know inherently who we want to be and what we want to accomplish and how we want to show up in the world. But if we can pair that then with the science and the medicine and the supplements and the good choices, and then we're living in our power. I mean, this gets me so excited. And I'm just so grateful that these things are available to us. And this new information, thank you so much for highlighting. This is a good thing for women everywhere. I think it's just incredible.
Agreed. I second everything, Catt.
Yeah, so you're going to walk out already feeling hopeful, not like afraid of getting older, but like, okay, now I know what I need to know.
It's also like empowering. Like knowledge is power, and I feel like sometimes it's just like when you don't have all of the information, when you have the information, you know what to do. It's when you're kind of stuck in this space of not knowing, and then there's kind of shame around talking about it, and you're embarrassed in this, and you don't even know where to go, or somebody shuts you down in the conversation, whether a doctor or a person or whatever. Like, having the information, then go live your best life. Yeah.
Yeah. Cheers to that.
Yeah.
Well, and thank you for all the work you do and all the patients you see, and spreading the love.
Oh, thank you.
Guys, this was great.
This was so fun. Yeah.
Fun. We should do it every Tuesday.
Yeah, I love it. I love it.
Oh, thank you. Thank you so much. And I'm going to link to all the things in my show notes so people can get more of the information that we just spoke about here. Awesome. Okay.
It was really informative, really helpful.
Love you guys.
Yay.
It sure is a beautiful day.